Man, nothing burns me up more than when people tell me that they put butter on burns. That's the exact wrong thing to do. We know it's from our heritage, but guess what? It's wrong. Today, I'm going to tell you about how to treat a burns. First, I'm going to tell you how to distinguish severe burns from minor burns. Then I'm going to tell you how to treat them. First-degree burns are the least severe and only affect the outermost layer of skin, known as the epidermis. They can cause redness and swelling of the skin that can sometimes be painful. Treat a first-degree burn as a minor burn unless it involves substantial portions of the hands, feet, face, groin or buttocks, or a major joint, which requires emergency medical attention. Some second-degree burns can be considered minor burns, while others may be more serious. Burns over the large areas of the skin or burns that are borderline third-degree burns should be checked out by a physician immediately because if untreated, they can cause contractures which can inhibit you from flexing and extending the skin after its healing. Second-degree burns affect the dermis layer of skin that's directly below the epidermis. You know you're dealing with a burn that's at least a second-degree burn if blisters appear on the skin shortly after being burned. Please, I'm saying it again, don't put butter on that. Most doctors agree that blisters caused by second-degree burns should never be punctured because this can increase the risk of infection. However, there are some studies that show that the unpunctured blisters can actually hold in inflammatory cells, which can do further damage. I personally believe you should keep the blisters intact. All blisters should be covered with fresh, sterile gauze a few times a day, depending on how bad they are. Keeping your blisters clean and dry is the best way to help them heal completely with minimal scarring. Second-degree burns may take a few weeks to heal completely. It all depends on how much of the dermis is affected and how severe the damage. Certain burns, such as those to the face, hands, or genitals, should always be examined by a physician. Third-degree burns, which are the most serious of all burns, will generally cause damage to all layers of the skin and may even burn bone, ligaments, muscles, or tendons below the skin. Immediate medical attention will always be required to treat them. Remove any clothing from a third-degree burn and cover with a clean towel or sheet immediately. Next, apply a cold compress and seek medical attention. Fourth-degree burns are some of the most serious burns that anyone could have actually and they survive. There are actually 6 burn degrees total, though you typically only hear about first, second, and third-degree burns. So, after all this, how do you treat the burn? I want people to listen. Never, ever, ever do anything except cool the burn off. Don't put butter on a burn. I've said it 3 times now. That's a myth that's been around far too long. And never put any kind of ointment on a burn unless specifically directed by a physician after you are examined. Ointments hold in the heat from a burn and make complications so much worse. So the very first thing to do when you have a burn is to cool the burned area. Hold the burned area under cool, not cold, running water for 10 to 15 minutes or until the pain subsides. If this is impractical, immerse the burn in cool water or cool it with cold compresses. Cooling the burn reduces swelling by conducting heat away from the skin. Don't put ice directly on the burn. Cover the burn with a sterile gauze bandage. Don't use fluffy cotton or any other material that may get lint in the wound. Wrap the gauze loosely to avoid putting pressure on the burned skin. Bandaging keeps air off the burn, reduces pain, and protects blistered skin. You should also take an over-the-counter pain reliever such as Motrin, Aleve, or Tylenol. Hopefully, armed with this information, you'll have everything you need for a speedy recovery from any burn that you might get and not get all hot under the collar. I'm your favorite doctor, Dr. Corey Hebert for BlackHealthTV.com.